Yukon Choice PC is sirolimus-eluting coronary stent system with the powerful synergy of biodegradable polymer and microporous surface with unmatched clinical evidence of efficacy and safety, which is published in 6 international journals: European Heart Journal, Journal of American College of Cardiology, ESC, Euro-Intervention, International Journal of Cardiology and Biomaterials, European Society of Cardiology guidelines for clinical use based on randomized trial with primary clinical endpoint achieved. The recommendation represents the highest validation conducted for proving the efficacy and safety of Yukon Choice PC. Pre-clinical data. Yukon Choice PC has one of the most strong pre-clinical data that is published in Biomaterials. It demonstrates the safety of drug release in Yukon. The release of sirolimus up till 4 weeks with significant tissue concentration in the arterial segment for anti-restenotic activity. Yukon Choice PC shows a reduced neointimal formation compared to bare metal stent without compromising vascular healing. Efficacy and safety data. ISAR Test 4 was published in the Journal of American College of Cardiology, in which Yukon Choice PC was compared with Zymes and Cypher in over 2,600 patients for their efficacy and safety. Yukon Choice PC with biodegradable polymer proves equivalence to Zymes and Cypher in terms of primary composite endpoints. Yukon Choice PC shows less target lesion revascularization in comparison to Zymes and Cypher. 5 years data. In a follow-up study at 5 years, the long-term safety and efficacy data states the incidence of primary endpoint composite of cardiac death, MI, TLR for Yukon Choice PC was equivalent and non-inferior to Zymes. In terms of safety outcome, Yukon Choice PC has a lesser rate of definite or probable stent thrombosis. Biodegradable polymer Yukon Choice PC and permanent polymer Zymes stent showed comparable clinical outcomes at 5 years. On other hand, permanent polymer Cypher stents showed higher rates of adverse events. Efficacy and safety data. European Heart Journal. In ISAR Test 4, Yukon has shown non-inferiority to Zymes and Cypher in a meta-analysis of over 4,062 patients from ISAR Test 3, ISAR Test 4 and Leaders randomized trial. Yukon Choice PC is the first DES which has shown statistical significant reduction of stent thrombosis by 50% compared to first-generation DES. Yukon Choice PC shows 78% reduction in very late stent thrombosis compared to first-generation DES. Diabetic subset analysis. A pooled analysis at individual diabetic patient data from 3 randomized clinical ISAR Test 3, ISAR Test 4 and Leaders at 4 years were analyzed for the definite and probable stent thrombosis as endpoint. Yukon Choice PC demonstrated lower rates of stent thrombosis in comparison with durable polymer drug-eluting stents in diabetic patient subset. STEMI patient subset. In a pooled data analysis from 3 randomized trials, ISAR 3, ISAR 4 and Leaders, we compared the outcome from biodegradable polymer Yukon PC with durable polymer at 4 years. In STEMI, biodegradable drug-eluting stents demonstrated superior clinical outcomes to durable polymer drug-eluting stents. Also, trends towards reduction were seen for cardiac death, MI, and stent thrombosis.